My name is Alisa Jones. I serve as the Chief Executive Officer here at Union Community Care. Union Community Care is a community health center, which means we provide physical health care, dental care, social services, and behavioral health to everyone in the community. It's offered at low price or no price, depending on the individual, and it's fantastic care. We've been doing it for over 50 years, and we're so pleased to be able to serve the community. So personally, I serve as the leader of a healthcare organization that serves the most vulnerable. We serve sick people every day. So I was the leader at the helm during a time when there were more questions than answers, when we couldn't get the equipment that we needed to keep our staff safe, when it was a challenge, when the prices were jacked up 200%, and worrying every day that the decisions we made were truly life and death decisions. So my team and I, we committed to doing the right things from the very beginning, and it started with keeping our staff and our patients safe. But in the midst of doing that as my job, I also had to deal with it through my family. And, in May of last year, my nephew, his name is Michael, he's 27, he got COVID, and he died at 27 years old. So this is not just an exercise, it's not just an experience, that I worked through, but it's an experience that I lived through. And Michael was a beautiful, beautiful, beautiful young man in the prime of his life. And there is no reason that he should be dead today. So this disease does not discriminate. And so I think that's why it's so important for us to understand that we actually have a tool now to prevent future deaths, to prevent getting seriously ill from COVID. And that tool is a vaccine. So, the partnership between Patients Are Waiting and Union Community Care has been in existence before the pandemic. We are aligned in our mission, which is to grow more representation among healthcare providers of people of color, and to ensure that they are in the pipeline and supported to be able to go and change the world as doctors and nurses and healthcare professionals in hospitals and community health centers like Union Community Care. When it comes to the vaccination effort, we knew that we could do this together. We could be stronger together than either of us could be alone. So we were able to support Patients Are Waiting to provide these pop-up vaccination clinics in the community. So we are going to community, not expecting them to come to us. And we are providing vaccines by folks that they know, folks that they trust, in places that they trust. We're making it fun for families to come out and get vaccinated. It's not a scary thing. We want to make sure folks don't feel like it's a scary thing. And it is really part of ensuring that our communities stay strong and that they stay healthy. Well, the reasoning behind it is because we have a shared purpose. So when you have a shared purpose, it is really, it's not a question, it's a how can we make it happen? And it's funny, but Dr. Hamblin and I have never met in person. We talked many times via phone and via remote, but because of the pandemic, we just couldn't connect in person. But really what we're trying to do is the same. So it was a non-issue. As soon as we were in a position that we had resources available, we reached out to them. We were able to execute a contract for these services right away. And by not providing so much red tape that it makes it impossible for a small nonprofit to participate, we were able to have them, be able to start this work really quickly, and they've done just a fabulous job. The mission for more equity is part of what's core to us, and it's core to them, so we're naturally aligned. When you look at who has gotten COVID, communities of color have gotten COVID more, they have been infected more, and that has to do a lot with the type of work that we do. So not all of us have jobs where we get to sit at home in our pajamas and work and get paid. A lot of us have jobs, we have to get out in the public. We work in jobs where we're interacting with people, therefore we are more likely to be exposed, and that's exactly what happened. So I would just share that communities of color, we have been more negatively impacted, but we're strong. We have been strong for hundreds and thousands of years, and we will get through this. We will come on the other side. A lot of us will have broken hearts, but we will get through this. We will get through this. And I think do what you can, get vaccinated, make sure that you get the people that you love vaccinated, that you encourage your friends, that you get good information. And if you're not sure where to get information, come to Union Community Care. We have doctors, nurse practitioners, providers with decades of experience, and they live here in the Lancaster community. You can trust what they say. So come and see us if you have questions about the vaccine, and be part of this community as we move forward, because we will all move forward, and we'll do it together, and we'll be stronger.